Hello, hello, hello. How is everyone today? Enjoying the program so far? Well, there's a lot of energy in the room because this subject is very, very important for all of us. There's a phrase that goes around in our community. When America has the cold, Black people have, and I take it a little bit further. When America has the cold, Black people have the flu, and Black women are in the ICU. So I got a nice little red table. That was nice. That was nice. We want to hear that throughout this discussion. Well, we are really excited to be talking to you about a subject that is incredibly important for us as Black women, and that's around our mental health. And I am so happy to have these two wonderful experts in this subject. So we're going to get started. First question is for Chanda. What strategies have you found to be particularly effective in promoting mental health awareness and destigmatizing discussions around mental health within Black communities?
Yeah, so when considering mental health, we always have to keep in mind the stigma associated with it. For so many years, we've been told that you're weak when you experience depression, or you lack faith when you have anxiety in our community. And I'm a firm believer that that is a lie from the fiery pits, is what we say in church. I'm a little churchy, y'all gotta excuse me. Amen? Okay, I gotta talk back church today. Okay. All right, so when we're talking about mental health, we have to learn how to destigmatize. And in order to destigmatize, it is important for us to go into the communities where Black people, especially Black women, frequent. And where are those places? Oftentimes it's in hair salons, it's oftentimes in church settings and things of that nature. So when we're talking about mental health, I always encourage my clinician friends not to be afraid to go into those community spaces. It is okay to have a support group or a mental health group or forum in a church setting. That's what we were talking about backstage. It's important to have those types of talks even in salons and barbershop. That is where we experience our community, right? We see each other in those spaces. So it's so important to meet people where they are.
Absolutely. Absolutely. So Jewelle, question for you. As a mental health professional and private practice owner, how would you describe past and present trends as it relates to Black women and mental health?
Absolutely. So I think a big thing that we're seeing is that our culture, we are trying to destigmatize the issues around mental health. And so we are having more open and frequent conversations about what we're experiencing. I think one of the things that we're seeing is that we don't always have the language, and we don't always know exactly what it is that I'm feeling, or I am feeling irritable, or I'm feeling somewhat distant from my social circles and things like that. And so we may not know that, oh, this may actually be symptoms of depression or symptoms of anxiety, right? But I think a lot of what I'm seeing is that we are starting to have the conversation more frequently, more organically, and people are starting to come into counseling. I talked yesterday at a conference, and I mentioned that when I first started in the field 15 years ago, I quite literally prayed for clients that looked like me, literally prayed. And over the last, I would say 5 years or so, I'm starting to see an influx of people of color, of women, of Black women coming into therapy and saying, I'm tired. I want to take off this mask. I want to unsubscribe to a lot of the narratives that the culture and society had placed upon me. And I don't know how to do it, but I'm here. And I think that's the first step, is to be able to acknowledge that something's going on for me that's not serving me, and I'm ready to do something different. So it's events like this that I'm seeing as well that are becoming more prominent, where companies are also having a change of topic, if you will, and we're starting to allow ourselves to be honest. So yeah, there's definitely, I think we were talking about this behind stage as well, is that we have a wait list. And right now for me, I would say 85–90% of my clients are Black women, are women of color. And as I said before, I was literally praying for people to look like me. And so we're changing the conversation. Yeah, so it's definitely moving in the right direction.
Excellent. And it's good that we are changing the conversation, because we know there are many, many reasons why especially in the Black community, we don't want to seek help for all of those reasons that you talked about. Chanda, can you share examples of successful initiatives or programs aimed at advancing mental health specifically for Black women, and what key components contribute to that success?
Yeah, so I would say the key components is really focusing on spaces where Black women can feel safe. Far too often in therapy settings, whether we're in professional settings or what have you, a lot of times we don't feel safe. And so even in the therapy room, we go there wearing our mask, the same mask that we wear in front of our families, the same mask that we wear in our communities, the same mask that we wear in our professions, because society tells us that when a Black woman experiences feelings, and when we show those feelings, oh, she's angry. Oh, she's difficult to work with, right? Oh, she needs to smile more at work, right? So all of these types of things causes us to wear a mask. But if I'm a Black woman, I'm going to therapy, I want to be in a space where I can remove that mask. Somebody say, remove the mask. Another key component of being able to feel safe and to be able to have these environments for Black women to be able to express themselves and to heal from generations of trauma is to really be in spaces where we allow us to talk about the emotions, right? To be able to provide the language that we're experiencing, right? So we were just talking about how Black women, oftentimes we're experiencing anxiety, but we don't realize it. But anger can be a symptom of anxiety. Irritability can be a symptom of anxiety. And when we have that language, we can actually talk about it. Specifically, the types of interventions that work well for Black women, we know that when we, with our sisters, we can be as transparent as possible, right? I love a good, group setting or what have you, but if it's a Black woman's group, oh, you mean I can take down my hair, I can take the lace front off, I can, show up as my full naked self, right? I can use colloquialisms that only we understand, right? And so when Black women are in supportive group spaces, we know that helps to provide a different level of intervention, because from an ancestral perspective, we are collectivistic by nature.
When Lauren Leader, CEO of All In Together, and I were talking about Black Women Lead, and we at Merck sponsor, Merck shout out for my ladies at work, okay. We were talking about, well, what do we want Merck to sponsor? What type of a panel? We usually do it in the area where healthcare, we're a pharmaceutical company, and we usually do it in the area of healthcare. And so this year I said, Lauren, we have to talk about Black women and mental health. It's a subject that it's still taboo a little bit, and we're going to have a room full of Black women and allies. We need to have this conversation, and I am so glad that the two of you have joined us. So Jewelle, this next question is for you. Based on your experience, what have been some of the barriers to Black women addressing our mental health needs?
That's a great question. So when I think of the barriers that impact us in addressing our needs, I think of it in two layers. There's the systemic piece or societal pieces, and then there's also cultural barriers. So systemic and societal barriers kind of look like the lack of access, right? And when I say access, I mean trying to find a therapist that looks like you is a big thing. We are literally extremely underrepresented. So that's a really big piece of it. I would say the other part of it is, again, kind of some of the stigmas that we're experiencing that go on. Financial resources are huge. And then one of the things that I actually see, and I don't know about this for you, but here in the DMV area, because a lot of us work in government positions and, there's clearances and all these things, there's some fear associated with going to therapy. How will this show up in my background check, right? If I use my insurance, how is this reported? And is this going to essentially come back and bite me? And so one of the things that I work really hard with Beyond the Couch is dispelling some of those fears, right? And dispelling some of those myths. So those are a lot of things that keep us out of therapy from a systemic and societal standpoint. But I think culturally, right, we are very much conditioned, and I absolutely believe in the power of prayer. Absolutely. Tenfold, 100, all toes down, believe in power of prayer. But I think sometimes there are these things that we're taught in our childhood that is based on someone else's understanding of something that we then, in our young minds, try to incorporate, and it actually serves as a barrier for us. You know, the whole like, don't claim it, pray about it. And you absolutely need to pray. But the Bible also says that faith without works is dead. So you got to do your part, sis. And sometimes that means going to therapy. Sometimes that means getting some type of medical intervention if you need medication or anti-anxiety medication, and understanding that it's both and, it's not either or. And we have to be able to do that. And so going into the church, that's something that Dr. Chanda and I have in common, and educating the pastors, because that's the other thing. We use the resources as a culture that are available to us. So when we're struggling in church, we go to the pastor, he pray over us, he lays hands, and all of that works, right? But if the pastor's not trained in mental health counseling and understanding that what you're experiencing is actually a mental illness, there's a limit to the way that he can help in that way. So I think partnering with our community organizations is huge.
You have to tell the story you were telling backstage about when you first went into college to study, what that dichotomy was.
Oh, I pray nobody sees this. So I shared that when I graduated high school, I was extremely overzealous and excited to major in psychology. That's what I always wanted to do. It was my thing. I wanted to talk to people and understand, why do we show up the way that we do? I was so excited. And I remember, this was 2002, just to age myself, so give you guys some perspective. I went to my pastor all excited, like, oh, I'm about to go to George Mason. I'm majoring in psychology. Boop, boop. I was so excited. And he says to me, oh, so you're going to the other side. And it was something that I carried with me. Right? I carried that with me. I went to school. I changed my major to marketing, and I got into marketing, and it was cool, you know, until I got to accounting, and then I realized God did not grace me. God did not grace me for accounting and marketing. And I called my cousin who's here today and supporting me, and I said, I can't do this. This isn't what I wasn't put here to do this. And I changed my major to psychology, and she said, if you do, you need to go all the way. And I went all the way, and now I own my own practice. But I had to dispel the myth, and I had to change the narrative that I had subscribed to, because I said, I am a God girl, I am a church girl, and I believe that we can have both and. I believe it's the same God in the church that's in these therapy rooms, right? So, yeah.
That's a beautiful story.
Thank you.
I know I caught you off guard, but I had to have you tell it. So we know that before we were Black women, we were young ladies and girls. And a statistic that Jewelle was sharing with us yesterday was that the number 2 cause of death for young Black girls is death by suicide. Number 2. And that is something that we have to correct. So Chanda, many times mental health awareness needs to start with young girls. How can parents and other individuals who are part of the ecosystem of young Black girls support their mental health?
Yeah, it really starts at home, right? It starts with really educating parents on how to get our children to open up, how to get them to talk about their emotions and their feelings. But how can we get our children to do that if parents are struggling with it? Right? And so a part of that is learning emotional vocabulary, right? So not just stopping when your child says, oh, I'm okay. You ask how you doing? Oh, I'm okay, I'm fine. No. What are you feeling emotionally? What are some words that we can identify a specific emotion that you're experiencing? And we often need to know how to provide safe spaces for teenagers. I'm gonna tell y'all a secret. Y'all's kids be telling us a lot of things that they don't wanna tell y'all because they're afraid of your reaction. They're afraid, well, if I tell my mom, she's gonna be mad at me. If I tell my mom I'm experiencing suicidal thoughts, she's gonna panic. And so parents have to be in a place where they are able to handle the emotions of children when they bring these types of things up, and not responding out of panic or fear, but letting your child know, listen, we're gonna work through this together. In addition to that, really recognizing, again, another topic. So y'all, we had a whole nother conference backstage. Y'all missed it. Part 2 can be at the end of this. But, you know, we were talking about how when Black kids do experience these types of things, oftentimes the spaces that they're in aren't necessarily safe enough for them to talk about it. And so when parents, they meet their child with, oh, you're being disrespectful. because of your attitude. You're being disrespectful. Well, does your child have an attitude or are they anxious? Does your child have an attitude or are they depressed about something that they don't feel, they don't have the vocabulary to articulate? And the same things that we experience at work when our bosses and supervisors says that, oh, you know, Black women, they're having an attitude when we're just experiencing emotion, we're doing the same thing to our kids in the homes. And so when we provide spaces for our children to feel and to express emotion and to help them label it, as opposed to labeling them as, oh, they're just being disrespectful, they're being cantankerous or whatever, we're able to provide them the emotional vocabulary and the space to be able to freely express.
Girl, we could talk about this all day. Because how many of y'all have daughters? Yes? We gotta talk a little bit more about that for them as well. So Jewelle, can you share some tips with us for taking care of our mental health and ways that we can continue to break the stigma associated with mental illness and therapy?
Absolutely. So the first thing is to understand that while we all have mental health, this means that none of us are exempt from mental illness. So that's the first part. And so I would say the next piece is understanding what health looks like and what it feels like for us, so that when we start to drift from that, we know that something's going on and we can attend to it. The other piece that I think is really important along those same lines is education, learning the symptoms, learning what this looks like and how it presents differently for us as Black women. Right? Is that irritability or feeling angry, that's not your personality necessarily. There may be something going on that you haven't attended to. Those body aches, because sometimes for us, the mental stressors can present themselves physically. That could be something else that's going on for you that you need to attend to, and understand that when you go to your doctor, they just may say like, oh yeah, you're experiencing this. And so if they don't know and you don't know, then you're stuck. Right? So I think it's really important for us to use the resources that are available to us to really understand what mental illness is, what it looks like, and that it is on a spectrum. So I'm not saying that if you have some anxiety today that you have an anxiety disorder, but understanding that it's on a spectrum, and it's important for us to understand these symptoms. And as far as breaking the stigma associated with it, again, I would say education is the big piece, being authentic, being honest about what you're experiencing. Again, we were talking about this backstage, and even yesterday, it's like, oh, well, I went through this, this, and this, and the other sister would be like, girl, me too, you know? And so being able to have these conversations, vulnerability breeds vulnerability. Vulnerability breeds vulnerability. So the more that you're vulnerable, the more you're open and honest, and the more that you create a safe space for someone else to be open and honest. There's healing in that as well. Yes. There's healing in that. So look at your boundaries, check in with yourself, get creative, create that time for yourself. It doesn't matter what's going on in your life, even if it's 5 minutes, create some time to be still, do some journaling, do some prayer, some meditation, exercise, watch what you're eating. Yeah, I would say those are the big things.
Excellent. So we're going to allow audience Q&A because we think this subject is too important for you not to be able to ask your question. So I'm going to ask one more question of the panelists, and they're going to answer, and then I'm going to turn it out to all of you and say who has a question for these expert panelists. So the last question, and you want to, either one of you want to answer it? How can we better address the unique mental health needs of Black women stemming from societal factors like racism and sexism?
Yeah, it really starts from a political framework, right? So when it comes to things like racism and systemic racism and how that works, we need to advocate more for what mental health looks like in the Black community. That means creating policies around this, creating policies around being able to get therapy, get services without having to hassle with our insurance companies. And I mean hassling on you guys' side and also on the provider side, because we do a lot of advocating for y'all as well. You know, being able to create policies even for our children, policies regarding schools. Why isn't there mental health education in school systems, in every school, right? Why aren't there more therapists and more psychologists on the grounds at some of these schools? And so when we're trying to target some of these things, a lot of it comes from a systemic approach and also from an educational approach. We got to keep in mind, like, we're not just angry about things happening in life. A lot of this can be a result of race-based traumatic stress, right? So when we experience racism, when we experience discrimination, and that thing is ancestral, and then we're talking about epigenetics in there, right? So all these things can play a role. And so it really starts with that education factor as well.
Yeah, I would ditto to all the things you said. Absolutely. And I would say the other piece too with the advocacy is showing up. I think the theme for today has been around using your voice and understanding and knowing that our voice has power and value. And so this is showing up at the school. It's showing up at community meetings and government meetings. I went to a meeting recently with the governor of Virginia that talked about the state of emergency that we're in regards to mental health. And then when you get in the room, ask the questions. Represent the people, whether it's your children, whether it's the people in your community. I think that those are really big things, is being present and using your voice, for sure.
We need to normalize this conversation, especially in our community. So we have mic runners that are available. Question, here's one right here up front. Want to raise your hand so there you go. And just say your name and company.
Yeah, certainly. Stacey Dennis. I'm with CHC, joining these lovely ladies at Bloomberg table. I am a mom myself who is trying to break the generational cycle of how I was raised. And so trying to provide that sort of safe space to communicate with both of my children, one girl, one boy. How does someone who wasn't taught to emotionally regulate allow space for children who you are trying to allow to emotionally regulate, but every once in a while that background starts to creep in? So would love to know kind of like, how do you create that space and still be able to sort of hold your own mental health in that balance as well?
Yeah, I mean, I would start by showing yourself some grace as well, because a lot of times we've normalized so many notions in our community to the point where we take them as truths. And just because we normalize it in our community doesn't necessarily mean that it's healthy, right? So show yourself some grace. If you find yourself reverting back to those patterns, then it just means that we need to develop new patterns, right? That is how we develop new, what we call those neurological pathways in the brain, or new ways of thinking and new ways of behaving, is we just create new ones. And so it might look a different way for your family than it looks for somebody else, and that's okay. And so it's really about finding what works for you and also highlighting what a healthy family system looks like for you. That's going to look completely different from my family and from your family and from her family or what have you. So whatever works for you guys, and then start to establish it from there.
I agree. I would say the grace piece. The other part that I would add is, even though we're the parents or we're the lead by example. If you're struggling with emotional regulation, that means they're struggling, join them together. My kids love the Peloton app. We do a meditation together. If all of us are dysregulated, it's like, come on, let's sit down. We're going to do some deep breathing. Even my 2-year-old now, she's like, and it's like when your mom's a therapist, right? She's in daycare doing deep breaths, right? So I want you, give yourself grace, but also lead by example. Have the conversation. It's okay to say like, oh, mommy's feeling frustrated. Why don't we all sit down and we're sitting crisscross applesauce and we're doing some deep breaths. It's okay to do that with them. Yeah.
Excellent. Another question. Oh, back here.
Good morning, everyone. Cynthia Ingram from Merck. I want to stay on this topic with how do we take care of our babies, right? And trying to build their emotional intelligence, but using the right words to help to get them to share their emotions. I'm a mother of 4. I have kids across the spectrum, right? One that's more of an introvert, teenager, and then I have a beautiful, sassy little girl, right? And then that conversation, that topic comes up around, disrespect, right? And I could hear my mom, in my head, like, you don't talk back, don't be disrespectful. So what are your tips for the words that we can use to navigate, the little sass that's shining through, but also communicate with a more introverted child who may not be as comfortable sharing emotions, but you want to create that safe space for them?
If I could real quick, the first thing that came to mind when you said that is check in with your child about their intention. when they're saying something, because not everything that they're saying is from the intent or they don't mean it the same way as we view it, right? Our lens is based on our experience and how we grew up. But like for me, I have a 10-year-old son and he says things just very matter-of-factly, and little Jewel feels like it's super disrespectful. Like I would never say this to my mom. But when I slowed down before I chastised him and said like, who are you talking to? You know, I caught myself and I was like, well, what did you mean by that? He's like, I was just saying I've never done that before. Why do you think I would do that now? I was like, oh, wow, okay. So I think that's the first piece, is like slow down and ask the questions as well. And then it's okay to course correct. If they are having a little spice in their tone or showing different things like that, it's okay to talk to them and teach them how they could say that better. You know, that doesn't feel good to mommy when you say it this way. What about saying it this way, right? How can you say that nicer?
Yeah, just piggybacking off of that, I love what you said about, it doesn't feel good for mommy to hear you talk like that, what have you. Because oftentimes we're not transparent enough with our kids about how we're feeling, and how sometimes, y'all are humans too. Parents are humans too. We can experience emotions as a result of a child's behavior. And so labeling that and highlighting that, allowing them to see that, helps them to also kind of change that up as well. And even going off of like modeling. Modeling is probably one of the most effective ways we can change behaviors in children, that and positive praise. So when we model what we're trying to get our child to do, like, mommy didn't like when you said it that way. I would rather you say it this way, and then give an example. Then we can start to help them kind of change up how they're saying things.
Any more back there? I'm sorry.
Good morning, ladies. Thank you so much. My name is Sharika. I am from Memphis. So I am a huge advocate for mental wellness and treating mental illness and emotional intelligence. So one of the things that I found with the companies that we do a lot of work with is, so one of the most underutilized benefits for all organizations is EAP, the Employee Assistance Program, because someone alluded to it earlier, that there's a lot of shame where it's completely anonymous, no one knows. But is there some sort of education or partnership with PTA education, PTA programs, as well as with lobbyists, to make sure that there is some sort of, and churches, because people believe if it comes from someone with a white lab coat and from the pulpit, you should do it. To actually have mental health professionals partner with churches to teach emotional intelligence and to normalize language around talking about your feelings, and making sure that families now have the language to do that.
We actually talked about this backstage as well. It's something we both do, ironically, which is partner with churches as well. And so I think what you're saying is absolutely accurate. And I think as the member, we need to talk to the leadership about what we need. It's okay to talk to pastors and I don't know, however the churches are set up, and kind of talk about like, this is something that's very prominent and it's coming up and we need to learn how to handle it. Like I said, I do a lot of partnerships with churches, and around that same thing is the educational piece around emotion regulation, emotional intelligence. But the other piece is around relationships. So when we're talking about generational trauma, can we talk about relationships within our family systems? Like that comes up a lot. And oftentimes I'm pulled to the side and it's like, okay, you talked about anxiety, you talked about depression, and that's great. But let me tell you what's causing it. Auntie so-and-so over here, right? Or this generational trauma and the things that we've swept under the rug because we all know that what happens in this house. Right. So all of these things are the things that we have to collaborate together with churches and even within our community systems. PTA, it's the same thing, right? It's understanding that all of these things are the same. They just go to a different building. So church is the same as the school, as the same as the government officials. They're just in different buildings. But our job is to still show up authentically and advocate for what we need. Yeah, and to be vulnerable.
We have time for one more quick question. This is table 4 here. She's had her hand up like 50,000 times. Oh. Can we go? Yeah, real quickly, because now we only have 1 minute left.
Sure. So yes, we see how trauma shows up in sexual health and financial health. So can you provide some techniques, tactics to help women with managing those type of issues when you see the trauma impacting their sexual or financial health, whichever topic you want to focus on?
I would say, finding the experts out there who specialize in that. Like there's literally intimacy coaches and people out there, sex therapists out there who can help to educate our communities and help people to relearn neurological, the neurological pathways that I talked about earlier, but also the maladaptive thoughts is what I was referring to. I'm sorry, y'all. The maladaptive thoughts, because, we had our other conference backstage, so it's like so many thoughts coming at once. But a lot of the maladaptive thoughts that were developed during these tragic and trauma-related experiences that people have caused them to have different experiences and relationships and sexual experiences, and even related to money. Sometimes we have traumatic experiences with money, right? Related to poverty, related to growing up in low SES communities, right? And so when we go to these different experts who can help us to relearn some healthier ways of developing in terms of sexual experiences and also how we manage money, then we can start to heal from that. So yeah, go to the experts.
Well, thank you to Chanda and to Jewelle. They were excellent, weren't they? So we want to thank each of you for listening to this very, very important conversation. And we want you to take some tidbits back home to your families, to you, to help you in this space, all right? We're going to normalize this conversation across our community. Thank you.